Hi Lacey, how are you today? My name is Julia. I am the medical technician that will be with you at your visit today. So we're just going to take a little bit of time right now just so we can go over the medical procedure that you will be in today, such as like expectations, what the surgery entails, and just some post-procedure things we need to just take a little look over. So it says here today you will be undergoing the Mohs surgery to treat your basal cell carcinoma. Of course, as you know, this type of cancer arises from the epidermis, which is the top layer of your skin. So this procedure is meant to save as much healthy tissue as we can and just remove all that cancerous cells out of your skin. This is also just a single visit procedure, very quick, with a follow-up visit to take out stitches and see the healing of the incision. You will be put on local anesthesia. That means like putting a shot at the area that we will be doing this procedure in. The area will get numb. You'll start feeling it to get numb, and you may feel some pressure when the surgeon starts. If anything feels too uncomfortable, too painful, please let us know. We are happy to put more anesthesia, like increase the dose, whatever you need to feel comfortable. So the surgeon that will be performing the procedure today is a dermatologist that specializes in carcinomas affecting the skin. So he will make an incision on the superior side of the cheek and inferior side of the eye area. So of course where you're affected, which is the zygomatic bone, so it'll be like right here in this area. They will take a biopsy of the epidermis, the top layer of your skin. They will examine it under a microscope, and examining under a microscope, they're looking for cancerous cells in your skin and taking and extracting those cancerous cells. This examination will take a couple minutes, so there'll be a little bit of waiting, not that much, and then once they see or they examine it, this procedure will go again and again, multiple times, until they reach a layer of skin that doesn't have any more cancerous cells. We do this just so we can preserve as much healthy tissue as possible and reduce the amount of damage to the subcutaneous layer of the skin. So the procedure again will end when there's no more cancerous cells detected. It is unlikely that we have to perform some kind of reconstructive surgery on your cheek or anything of that nature. Most and all of the times the wounds heal by themselves. A couple stitches and you're good to go. Our main goals for this procedure is to cure you, take all those cancerous cells out, and to make sure the incisions heal up nicely so no scar is noticeable. You don't see something out of the blue. You know, we don't want a big scar on our face. You may feel some swelling, bruising, and discomfort post-surgery. Perfectly normal. You can always put an ice pack on your cheek, take some over-the-counter medications, and of course we do recommend a lot of rest afterwards. It is important that you come back so that we can see that the wound is healing, take out the stitches, maybe even recommend some stuff to heal faster, or we just want to make sure that it's healing properly. This will ensure the best possible outcome to your surgery and best possible outcome to your healing. So we will schedule up an appointment a few weeks after, or even 2 weeks after, just so we can see what's going on. So we'll be right with you and we can get this procedure started.